What is croup? Viral croup is an infection of the vocal cords, or the larynx, that causes a cough that sounds like a seal's bark and noisy breathing. Croup is usually caused by a group of organisms called the parainfluenza viruses. Other viruses, such as measles and adenovirus, may also cause croup. Although anyone at any age can develop croup, it mostly occurs in babies and children between 3 months and 5 years of age. In the northern part of the country, the infection is most common in the late fall through early spring. However, infection can occur at any time of the year. In the past, diphtheria caused a deadly form of croup. Routine child immunizations have made diphtheria rare today. Still, bacteria can sometimes cause croup-like illness or make viral croup worse. Signs of bacterial infection include worsening of croup symptoms, high-grade fever of more than 102 degrees rectally, and increased difficulty breathing. Another serious form of croup is called epiglottitis. Epiglottitis causes a serious blockage of the airways. Epiglottitis is a life-threatening condition and requires emergency treatment. It is important to seek immediate medical attention when symptoms of croup are severe or get worse. Today, most croup infections are not life-threatening. Still, it can be frightening when your child seems to be struggling to breathe. Because anxiety and crying can make the symptoms worse, it's important to remain calm and keep your child as calm as possible. Try to remember that croup is rarely as serious as it appears to be. If symptoms occur in the middle of the night, which they often do, there are some simple things you can do to relieve symptoms. If symptoms do not respond, or if symptoms are worsening, call your physician immediately. In mild cases, you can usually wait until morning to call your child's doctor. He or she may want to examine your child just to make sure things are okay. What are the symptoms? The most recognizable symptom of croup is the cough, which sounds like a barking seal. Hoarseness, along with difficult, noisy breathing, is also common. Symptoms are caused by swelling and mucus production in the vocal cords. Before the onset of croup, your child may experience symptoms of a typical cold, such as a runny nose, a low-grade fever, and a mild cough. The barking cough and difficulty breathing often begin within a day or two after the start of cold symptoms, and usually during the night. You may be awakened in the middle of the night by the sounds of the barking cough. Your child may appear to be gasping for air and choking, which can be frightening. Because anxiety and crying can make symptoms worse, it is important to remain calm and keep your child calm. Remember that croup is often not as serious as it looks, and there are some simple things you can do to relieve symptoms. Symptoms may get better during the day, but recur during the next few nights. Most often, symptoms of croup go away entirely within 3 to 7 days.